Very good. I will get us started. Good afternoon, good evening, and good morning, everybody, depending on where people are coming in from. I'm Sandro Galea. I have the privilege of serving as Dean of the Boston University School of Public Health, and I am zooming in from Boston in the United States. I'm doing this in my role as the chair of the Rockefeller Boston University Commission on Social Determinants, Data, and Decision-Making, what we call the 3D Commission. I'll give a little bit of history. The 3D Commission was started in 2019, conceived in early 2019, long before COVID had ever become anything that was on any of our radars. And the idea behind the commission was to think about how we can leverage the burgeoning social determinants agenda, measure social determinants better, bring big data approaches to social determinants to make better decisions around health. That was in early 2019. We started the work in about mid-2019. And of course, as the work started in earnest, then COVID hit the world and COVID transformed all our lives. And in many ways, COVID made everything that the commission was thinking about ever more salient and ever more important, because it became very clear very quickly, as we heard in a previous conversation, that COVID was all about the social determinants. That yes, COVID was about a virus, it was about a novel coronavirus, but the way COVID manifested was fundamentally about social determinants. So the commission did its work against the backdrop of COVID over the past 18 months to 2 years. And the work of the commission is culminating in a final report. And the report embeds a set of principles and recommendations for decision makers, policymakers, but also civil society around how we may think about doing a better job of incorporating social determinants in our thinking about the decisions that ultimately influence our health, and how we can better measure those using data. The report will be released at the UN General Assembly coming up in 2 weeks' time, and everybody who's on here is invited to attend that. It will also be at the Zoom event. And leading up to the UNGA launch, we are doing a series of conversations with experts who think about these topics, who think about the intersection of data, social determinants, and decision-making, and who have applied that thinking to different sectors and different perspectives. And in this conversation, it's my really great privilege to welcome Dr. Naveen Rao. A few words of introduction about Dr. Rao. Dr. Rao is the Senior Vice President of the Health Initiative at Rockefeller Foundation, and he was the intellectual architect really of this project. Dr. Rao leads the foundation's work to ensure more equitable access to COVID-19 tests and vaccines, science-based tools and data to fight the pandemic, and strengthening public health systems to prevent future outbreaks. Under Dr. Rao's leadership, the foundation launched a Precision Public Health Initiative and expanded this data-driven public health approach to address the current COVID-19 pandemic globally. Dr. Rao is also spearheading the foundation's efforts to use data to predict, prevent, and quickly respond to future pandemics, including by facilitating greater global collaboration around genomic surveillance. On a personal note, Dr. Rao is a longtime friend, and it really has been a pleasure to work with him on conceiving of this commission, conceiving of the intellectual questions that the commission set out to answer. And then over the past 2 years, as we have together literally, Naveen and I, but also all of us in this world, navigated what we are learning and the intersection of how the world has changed with the questions we were asking, thinking about how to sharpen our questions to make sure that the work that we're doing is as relevant as possible to a future post-COVID-19. Naveen, welcome. It's great to have you. I think you're on mute, Naveen.
Sorry, you'd think after 2 years I'd know better than that, but apologies. Yes, I was saying it's a pleasure, is mutual, Sandro, and I'm all looking forward to the conversation.
Okay, so let me start, Dr. Rao, with we'll go back to sort of a genesis question. Maybe you can lead us through your thinking and the foundation's thinking around the intersection of social determinants, data, and decision making. What was your early thinking about this? This is, as I said in my introduction, long before COVID. What sparked your interest in that? How did that emerge from your work then around precision public health? And how did that sort of become the set of questions that we set out to address?
So it's amazing how some things stay in your mind, Sandro, and I'm taking us back, you and I, in Geneva. We had planned to meet. We were looking for a coffee shop. I even remember what you ordered. And this is going back maybe 3 years ago. And the reason is so vivid in my mind is because we had a conversation there that went something in the lines of, And I'm starting there because it's very germane to the conversation today. I remember our conversation went something in the lines of, in this day and age where we've come so far and technology has disrupted in a positive way so many aspects of our life, why are we still dealing with public health from the 19th century, whereas the rest of our life seems to have moved into the 21st century, whether it be banking, music, and we were talking about that, and we were in a way riffing off each other. And then the question came to health versus healthcare, and how health in people's mind had become doctors, medicines, hospitals, all towards the healthcare part. Whereas you and I both realize that just 20%, 25% of our health is healthcare. 75% is health, which is the food we eat, the quality of the air we breathe, the violence we're exposed to, where we live, our religion, our education, and that those, if they account for 75% of our health, we seem to be chasing the shiny toy on healthcare and somehow confabulating health and healthcare and thinking more linear therapies for cancer or more tertiary care units for cardiac catheterization was the way to good health, whereas we realized, you and I, that it was more on the health side and not the healthcare side we need to focus, and that technology also was taking us more towards the healthcare side. So the last point I want to emphasize is the question I think you asked, Sandro, that kind of galvanized this whole thing is, you said, with technology, we seem to be getting better at fishing bodies out of the river downstream. But the question we need to ask ourselves is, who's throwing them in? And we may be getting better and more technology, better hospitals, better doctors, better medicines that will save more people. But the answer lies in making sure they're not thrown into the river in the first place because of poor nutrition and bad quality of food or violence. So that was the start of, can we bring social determinants of health, technology, and then the last piece was, how can we really get the people whose hand is on the decision making to come into this scenario? So that is the genesis. You're a big part of it, but I clearly remember where we were when we started this journey, Sandro.
That's actually a terrific summary, Naveen. Let me ask another question building on that. And I'm still sticking pre-COVID. I'm going to get to COVID in a second because it's inevitable that we talk about COVID. But can you talk a little bit about how that agenda that you just articulated right now, how does that intersect with the Foundation's broader agenda, with how the Foundation sees itself, with its vision and mission? And in some respects, and it really is, it's a hard exercise to think pre-COVID, but I'm asking you to go pre-COVID, and how did that fit in then? And then we're going to shift to COVID and how COVID has modified it.
No, I'm glad you're doing this because you see the genesis of all this was even pre-COVID and how absolutely relevant it is in the current stage. And COVID has actually exacerbated and brought to a sharper focus, but the issues were under the surface all along. When we came to this field, I look back, and Rockefeller Foundation has the legacy of having established the field of public health. The first school of public health, Johns Hopkins, was funded by Rockefeller, and the way Rockefeller came into this in the early part of this century early part of last century, was not because one day Rockefeller decided we will establish the School of Public Health and start public health. They started very much on tackling a local problem that was endemic at that time, which was hookworm in the southern states in the United States of America. Hookworm was really, pun intended, bleeding that whole region, and so Rockefeller went about establishing data-driven interventions, such as how long does the hookworm travel, and so how wide do the trenches need to be, about sanitation, footwear. And so it's amazing how using data and data-driven approaches, Rockefeller was able to eradicate hookworm in the South. And when it sat back, it realized that the lessons we had learned in doing that were public health lessons that encompass social determinants of health, including sanitation and all aspects around it. With that legacy, I asked myself, isn't it time we took public health to the 21st century and now started calling it precision public health? And this is all pre-COVID, where we realized the importance of bringing data and data science to public health. And in that legacy, moving public health from the 19th century to the 21st century, using data and data science with precision so that we could get to the right intervention to the right people at the right time.
There's actually, that's a really wonderful synergy between the agenda of the commission and the foundation. Now let's shift to COVID. Let's make the inevitable shift to COVID. So let's talk a little bit about what you're doing in context of COVID. And you're in part responsible for the foundation doing what I think is actually exactly the right thing, thinking about public health investment in future to prevent future pandemics. So how does that intersect then with this agenda? How does that intersect with the social determinants agenda, a data-informed social determinants agenda? And how does that intersect with the decisions that need to be made so that we are not as vulnerable to the next pandemic?
So it's an excellent question, and I'm going back in COVID to pre-vaccine now. So even in the COVID journey,
yes, there's pre-vaccine, post-vaccine in COVID, yes.
Post-vaccine, and I don't want to forget the pre-vaccine lessons and what we did and how that shaped us and where we are today. And it's really germane because as the variants are coming up, we're realizing there's no panacea. It's not that the vaccines are going to just come in and switch the whole thing off. So when COVID first hit, we realized the paucity of data and information. And I'm taking us back to the time when we knew COVID had come and we knew that hospitalization and deaths were on the rise, but we had no idea which states, we had no idea which populations. Now it's hard to believe, but there was a time when we didn't know it was the elderly in the nursing home. There was a time when we didn't know it was the Navajo Nation. There was a time when we didn't know it was the Black and indigenous populations and the BIPOC populations in certain cities and certain. We didn't know that. We knew it was happening. We knew it had crossed all boundaries and it was affecting everyone as opposed to previous endemics and pandemics. But we didn't know where it was happening. So at that point, we at Rockefeller funded the COVID tracking project. And we charged them with collecting all the data that we had from various sources, and this is the whole social determinants of health concept, and trying to publish it in one place. And we realized that that is actually the basis of how we started even getting a handle on the COVID situation in the US was understanding that without accurate information, we were again, pun intended, dead in the water. So the lesson we learned there is still helping us because then we realized we didn't have data as we moved on. We didn't have genomic surveillance data, and then we were able to fund the GISAID consortium to try to get genomic surveillance data. And now we're saying, should we do wastewater surveillance to get data? So it just has built on itself, but it all started from the concept that we were flying blind. And the analogy that comes to mind is we were flying with data that was weeks old. It's like a pilot flying and being told you just passed Denver 2 hours ago. You don't know where you are now, but you did pass Denver 2 hours ago was the feeling we had. And
it's a great analogy.
So we really realized, and so that was also a moment where we realized our precision public health story using social determinants of health and how can we bring it all together to be able to get a better handle of what was happening now. There's a lot more I can talk about, but I'll wait for your next question. And I'm hoping that I'm addressing the parts that you want me to address. Otherwise, steer me.
Absolutely. So let's shift to. We're still in COVID now. Let's talk about decision making for a second, because I often feel that, and I think the Commission has struggled with this a little bit, that in some respects the ideas around data and the ideas around social determinants are so strong that they almost overwhelm the decision-making element. And of course, decision-making is the instrumental arm of the whole triad. If you have 3Ds, data determines decision making, it's ultimately about making decisions. So let's talk a little bit about that. And can you guide us through how are you and the foundation thinking about decision making in a post, or at least peri and post-COVID times? And how are you seeing the decision making? And perhaps I'm going to push you a little bit on the, if I may adjective, some of the calamitous decision making that the world has made around COVID. But how do we avoid that going forward?
So this plays into Rockefeller's objective right now is to help stand up a pandemic prevention institute. There are multiple such organizations being set up. Everyone realized that the clarion call that we needs to be loud and clear and politically free. And that if you really go back to how decisions were made in this pandemic, and I'm talking as an individual now, if I look back and the way the data was very, very understandably and predictably kept under wraps for a while till people understood what it really meant. But unfortunately, during that time, it really got out, and literally by the time we got around to it, it was already too late. The political pressures that countries were able to put on organizations that were responsible to call this the pandemic at the time it's supposed, in retrospect, it all seems like we could have done better. So the question comes, how are decisions to be made that are politically free, that are locally respecting local culture, local practices, but on the other hand, effective, timely, and moving from a finger pointing, stigmatizing kind of mindset to we're all in it together. We all either sink or we swim together, and it's not just any one person. So in that whole context, we realize decision making has to be freed. And one of the ways we started approaching this is we noticed that there was a time even in the US when the states had been given the responsibility for testing. That to a certain extent, the federal government at that point said to the state governments, you are responsible for testing. Here, you now get testing in your states. And quite a lot of the states were floundering at that point, and they realized that based on political pressures, on social pressures, economic pressures, whether to keep states open or not, whether to mask, whether to mandate, whether to test, was all coming under literally all the states were approaching it from a different mindset. So we asked, is there a role for Rockefeller Foundation to bring what we call the Pandemic Solution Group together, where we invited decision makers from all the states and certain key cities to join us, and that we use this platform for peer learning for Oklahoma, for New Orleans to say, hey, look, we tried this testing method and we went out to this place and we were able to get this testing done. I hate to do this. My grandchildren are talking. This is part of working from home. Just give me a minute.
Yes, fine. It's fine. Absolutely.
Sorry about that. So, one second. So then we set up this pandemic solution group that was very successful, to the point where right now it still exists, it still works, and the STAT group is still helping each other. We have a STAT group that the states help each other. And to a certain extent, they're saying you Rockefeller, an independent platform, is allowing us to talk to CDC and USG also. So there is a role to divest decision making from politics, from religion, from social pressures. And it comes back to data again, Sandro. I feel, and there are many examples in life, that data is the liberating secret ingredient in this. So if you really take how real estate used to be done in the United States. There was a black box where the prices of the real estate and what they were selling for around your house, you had no access to, and you had to rely on a real estate agent who looked into the box and said, this is what I think the price of your house should be. You had no insight and no input into it. Then Zillow came along and just published the data, and all the data is out there and it's accessible to everyone, and you make your decision. And how data is liberating, and this feeling that people won't know how to handle data and that we need to be an informed intermediary and have somehow control of the data, and that decisions can only be made by a few who are smart enough to know what the data means. I think that mindset has to go. We've seen that in so many, one second, this is, sorry. This whole thing that we need to somehow protect data and protect the people, the decision makers, and the public, and that there is some way that we can now liberate this data. And there's really no reason why, just like you on your phone app are going to get a thing saying that we expect rain, bring your umbrella, that we can't send out a message saying there's something happening in your region, wear a mask.
I love the house hunting analogy. I had never heard of an analogy, but it makes a lot of sense. Let's talk about an envisioned future then. So let's talk about an envisioned future for decision makers. So X years from now, with the work that you're doing, COVID is now a memory, but other threats emerge. So what is your envisioned future? What does the decision maker, what does she have at her fingertips that is helping her make the decisions that are needed to generate better health?
So the levels of decision maker, either I can go top down or bottom up. At the top of the line would be the health minister, the finance minister, who have to make decisions on whether to divert money and what does this mean in terms of the economy, and to close down or lock down or not lock down. So there are those decisions that have to be made at that level. But the point I'm trying to make is they're not isolated. The level below that is perhaps the hospital manager and the doctor about how do we manage this, and what is quarantining, and how much oxygen do we need, how many beds, all those decisions. Then there is the community leader who's in the village, who needs to decide whether this threat is real, and whether the children should be sent to school, or whether the school should be closed, and what does it mean. And then there's the individual who needs to be told there's something happening, and then he or she has to decide whether they're going to attend that wedding that evening. And it's all connected, but they're looking at different data sets. And to presume that there's one data set that will get to everyone, or that the analyses from these data have to be different, but the data sets have to be the same. There has to be one truth. And from that, we should be able to come up with those analyses that different levels need to make their decisions, but they all have to work out of one data set. Is there or is there not a threat? Is there or not a spillover from zoonotic? Is there or not a certain surge in travel, in social media queries and searches that have keywords that tell us there's something wrong? Are there an inordinate number of plane tickets being bought out of Wuhan? That was clearly a signal that we missed, and that Blue Dot brought it out later, that there was a huge number of people leaving Wuhan before anything the world knew. It would have been helpful if we knew all that. So the data needs to be transparent, the data needs to be one truth, and the analysis coming from that need to be where we need to focus to help our decision makers to come up with better decisions.
Let's push on that a little bit, and let's talk about two issues which actually the Commission talked about quite a bit, which are issues of data privacy and data ownership. So the envisioned future, which I really like the picture that you painted, is rests on a number of assumptions, of course, about data. But let's talk about two of these, which is privacy and ownership. So who owns the data, and how, in a world where everybody here in this conversation, listening to this conversation, recognizes that there are multiple ways in which we contribute to that data and what implications that has for our privacy. I was wondering if you can guide us through your thinking about those two issues.
Yeah, and it's so thorny that whatever I say, the opposite would be equally true. So with those caveats, I really feel data has been likened to the new oil, and data itself is the source of power and financial. Those who own the data are the ones who will have the power. Just like countries that had oil became rich versus countries that didn't have oil became rich. So those that have the data and our Googles and all the companies based on data show the fact that those who have data will thrive. In that instance, and if you're building all this on the back of individual data, as long as those people get the benefits of that, then I am fine. My problem comes from using that data, and then the local person who got that data gets no benefit from it. And right now, we also need to be careful, and I don't know how to voice this other than how it's coming out in my head, is that we're not bringing in global north issues into the global south. If global south data privacy is not as important or vital to the local people as survival is based on insights from that data, then we need to make sure that we're not patronizing them and excluding them from the benefits because of the perceived lack of privacy. I agree we need to focus on privacy, and that it's vital that they get the benefit of the data. But privacy as we know it in the West and in the North, I am a little hesitant to bring all that to the South based on their needs right now, and in a way patronize and exclude them from the benefits. So yes, both data privacy and data ownership are vital and important. The global world needs to collectively come up with answers, and there are other industries that have done this. There are industries that talk about data and privacy and how do we share it and who gets. And we could take lessons from so many places, including the movie industry. Apparently, they do this extremely well. Who owns the rights to the movie? Who gets the benefits? How is it shared? I mean, and how is it put into a pool? I mean, there are industries that have solved this. We just need to have the mindset of saying we want to bring that to health, and that there is a way to solve it. And we can't let privacy and our ownership stop us.
Those are actually really interesting points, and I think that the point about norms, right, and about the what are absolute norms versus relative norms, and what are the absolute norms with which one wants to live, and the relative norms which might be different in different contexts. I think that there are whole books to be written sort of and discussed about that. Let me talk about one other aspect of data, which is accountability. So an accountability to the people from where the data comes. And one of the issues that I think has emerged very strongly in the context of COVID. And as with everything else that emerged during COVID, it's not a COVID issue. It was there before, but COVID lifted it to the surface, was the need to have data to be accountable to the health needs of populations. And it is hard to argue that we have done that in a time when we have seen enormous racial, ethnic, socioeconomic divisions in the consequence of COVID. We have not really been accountable to populations from where the data come. So I was wondering if you can comment a little bit on your thoughts about that, on accountability to populations of data, particularly around data around their social determinants that is supposed to close a loop and improve their health.
So this is where I feel there's limitations to data. And we have to accept it. And the biggest example staring at us is climate change.
Yeah.
Now, when we see that image of that polar bear stranded on a small piece of ice, what more data do we need to tell us something is happening? But yet, climate change continues. And very often the people who are doing the climate change pollution are not the people who are suffering the most. The ones who are suffering are those who are living in those island communities that are going to be submerged soon, and they did nothing to add to this. So even in the health side, I really feel we come to a stage where we realize more data is not what is needed here right now. We need to collectively understand and hear what the concerns are and see what we can bring from what we already have, rather than feel, oh, we need another commission to look into this, just as we don't need another commission to tell us whether or not there's climate change. But that's exactly where we are on both issues.
No, I really like. Let me apply that to an issue that is I know that you've thought a lot about through the commission through the foundation, and also of course we're all thinking about, which is the issue of vaccine uptake and vaccine equity. And I was wondering if you can comment a little bit about, through the lens of the issue of right now of ensuring that everybody has access to vaccines equitably and everybody is able to get vaccinated, and then how that of course intersecting with information and challenges to information about the safety and efficacy of vaccines. I was wondering if your thoughts around data to inform better population decision making around vaccines.
Yeah. So I'm sorry, this may sound a little too cute, but we have broken it down into the 3Ds that we realize there is the dollars end of it, and that's the access and financing and dollars end of it. The second D is deployment. We know it's easy to get the vaccines into the docks of the countries if they're donated, but what happens from the dock to the arms of the people, and including HR and cold chain and all of that. And the third is demand, that when the first wave comes through of those who want vaccines, and then how do you get the anti-vax messaging, and how do you get the misinformation and mistrust out of the way? And underlying all this is, how do you get the digital backbone to make sure that all this happens?
Mhm.
And it's not easy. We need to pick our place. All these Ds need to be addressed, but there's no one institute or one place that all three right now reside. So we need to make sure, for example, right now in certain states, it's about the demand and the misinformation. And whereas in some countries, it's still financing. And in some places, it's the deployment, including HR and transportation and cold chain. So vaccine is a complex issue, but it absolutely starkly shows the difference between the haves and the have-nots. And if you have the financing and the deployment done, you're now going to deal with the demand part. And if you don't even have financing, you're not worried about the demand and the deployment, because there is no vaccine. So in this life cycle, the question is, how can we as a community come together, and what role should private sector play? What role should WHO play? What role should Gavi, CEPI, all of us play, and which piece should we own, and work more like a symphony with a conductor, rather than each one of us trying to get either our own instrument or our own band going?
That's actually, I think the 3Ds are quite helpful. Actually, I think it's actually it's a very helpful way to divide it, and it's helpful to think about data informing each of the different 3Ds, and to help to think of data in there's different data that is going to be helpful in each of those.
And different decision making also.
And different decision making. Can you go back? Can you go back in time a little bit and think about our appreciation of the role of social determinants, and how do you see the arc of how social determinants has entered into our health conversation, and where do you think we're at on the journey collectively of seeing the social determinants as being essential to this entire conversation, to conversations like it?
Yeah, so again, Sandro, this came to me sharply when I was in Chicago, and in part of the presentation, I was shown data that the subway loop out of Chicago downtown, and apparently every stop you took outside and went more towards the communities or BIPOC communities, you lost 10 years of life expectancy, meaning to say you were where US was 10 years ago in life expectancy. And by the time you reached the seventh spot, you were 70 years. America was where that community is today, 70 years ago in terms of life expectancy. And it's just 7 subway stops. And if it is so dramatic, and if it is so clear what the difference is in that community, seventh stop versus the downtown community, and if you look at it, and if that doesn't tell you how important social determinants are and why those communities are dealing with that kind of life expectancy and quality of life, there is really nothing more stark. And this is today. I mean, this was pre-COVID. So I can just imagine now today in COVID, how much more because of the economic burden those communities are bearing in terms of jobs and income. So it's only going to get worse. And if you really look at the haves and the have-nots, I really believe that today the class distinction of the haves and the have-nots is based on money. And those who have more money have better health, and those who don't have money have poorer health. I predict that the class distinction of tomorrow will be access to data. And those who have access to data will have better health than those who don't have access to data. And we know which communities are not going to have access to data because they don't have it today and it's getting worse. So unless we break this, unless we have access to data as a great equalizer, we are going to continue to create a new class divide, which reflect on health.
And that's a theme in this entire conversation that would really get at this envisioned future where we do not have those inequities, where we actually have decision making that's informed by social determinants. So let me ask you my last sort of substantive question. Then I'll ask you one last personal question. What will it take? What do you think are key steps that we collectively, now of course each of us have different domains of spheres of influence and spheres of engagement, but we collectively in all various spheres need to take to get to this envisioned future? What do you think are key steps that at local, state, federal, global levels that need to be taken to get us to a future where we are well informed about the drivers of health to the end of doing the right thing by everybody promoting health for all, narrowing health gaps?
It's a tough one. I wish there was a simple answer, but the one that comes closest in my mind is democratizing data and making it available and respecting people. And in any industry where that has happened, then there has been an equalization to a certain extent. And everywhere where data has been kept privileged, that has continued to drive the divide. We need to bridge the gap. And I really do believe data can either worsen it, or when I say data can worsen it, I mean holding data hostage and keeping it to yourself and making, that's how all the middlemen and the middle countries and everything worked, versus wherever it's been liberated, I believe it has helped everyone. And so we are at that crossroads. Are we going to allow the haves to let go of the monopoly and to share and to bring the best out? And yes, make your profits and grow your companies and grow your industries and grow. I mean, I don't begrudge any. I've come from the private sector myself, having worked at a pharmaceutical company for 25 years. So I get it. I see that. I know the importance of that. But unless we align our collective goal and understand that it is through liberating data and allowing people to make decisions and not feeling that you need to protect them and that they won't know how to handle data that needs to change. And if that changes, and it's the same theme I'm probably saying from the beginning till now, as you picked up, Sandro, is that we're at a place where data can allow decision making and allow us to erase this social determinants of health that continue to drag certain populations down.
That's a terrific answer. Well, let me ask you a last question. And this is, we often have students who watch these conversations either live or afterwards. So if I may ask then about you and your career trajectory, you've done remarkable things for health. And can you just comment a little bit on your own journey and what you think have been key milestones in your in your journey that have informed your thinking, bringing you to where you are today, and really with an eye towards, as students are asking, sort of, who are you? How do I get to be Dr. Rao? How do I get to make the kind of impact that he's making?
Wow, that is really the toughest. Can we go back to the other questions? I mean, it's
that's why I saved the hardest question for last. I figured you'd be warmed up by now.
So who am I and why? So I guess there's a streak in me, and I laid all in my at my mother's feet. She was the one who taught me it's more what you leave behind than what you have taken. It's more making sure that you walked in somebody else's shoe before you judge them. And it's more about what you have given and built, not what you have taken and eaten. So, it's those kind of concepts as a child. And so I guess they were in me. And then I was very clear I wanted to be a doctor and help. But at one stage, I realized that I had visions, or I had the wherewithal to paint on a larger canvas. And I had a choice at one stage whether to stay with clinical medicine, which was basically one prescription, one stethoscope, and one patient at a time. Or I could move up and use my skills or my gifts that I was given to affect a larger swath of populations. And that's how I got into public health, never starting the journey that way, but being a regular doctor for 12 years, practiced medicine, the whole bit, and then realized that there's a piece in me that could play a larger, and I keep saying paint on a bigger canvas. And that's how it started. And the canvas kept getting bigger. And so now I seem to have filled a wall. And I'm at that stage where I'm feeling very good and can look back and say, look, when I hang my work clothes up, then I can feel I made a difference in that, and that it was all about seeing how you could respect people and bring them to the stage where they can take care of themselves.
Well, that was a wonderful answer. Thank you. Naveen, thank you for the conversation. Really, really very much appreciated. We appreciate the work that you have done in creating this work. And I, for one, am excited to see how this work intersects with the post-COVID world, leaning heavily into the post-COVID world. I really want us to get to the post-COVID world and to create a better world, for your grandchildren. Seem to be having fun, and we want them to actually to grow up in a world, and my children to grow up in a world where actually we are making better decisions, smarter decisions for all our health. So thank you for all you're doing to get us there.
I must say though, Sandro, I take your thank you with humility, and it is a little stressful because you are the one who has such visionary thoughts and consistently are able to write an article. Your goldfish is really thought-provoking. I look forward to it. Your books have also influenced me. So to keep myself open to answer your questions was a leap of faith because, for everything I said, I really genuinely believe you could probably said it better.
Well, thank you, Naveen. It's really a privilege to work with you, and we could go on forever, but we'll let you get on with your afternoon and evening, and we'll let everybody go on with their night, afternoon, or morning. Thank you once again, everybody.